Hi, we have Dr. Manohar. Is a urologist in Apollo Hospital. Apollo Hospital has invented a new technology to treat prostate problems in youngsters. I request Dr. Manohar to explain this new technology.
Yeah. So today I want to address few important issues like the awareness of the prostate problem in younger generation, and thereby the second option of treating them, curing them without having any side effects. Generally, we assume that more than 50 years of the men suffer from prostate problem like urinary urgency, poor stream, frequency, passing urine in the night time. So it is very common. 50% of the men suffer from prostate problem after 50 years and 90% suffer after the age of 8 years. We all know this, it's general awareness. But here we have a situation where people from 18 years to 35 years, 45 years also can suffer from urinary problem secondary to bladder neck obstruction and prostate obstruction. It is called as complex, prostate bladder neck complex. So as early as 18 years, the people can suffer from prostate obstruction. If they present very severe obstruction as compared to the older people. So it assumes very important. So these men, when they produce with severe obstruction, when there's a blockage, they produce with bladder failure, recurrent urinary tract infection, pelvic pain, kidney failure can lead to as a complication if untreated. So to treat this problem, earlier we had some medications and surgical portions like in adults. If we treat by medications, it used to produce us sexual dysfunction, infertility problem, ejaculatory dysfunction. So we had some treatment, but it producing a lot of side effects. If you do a surgery, they produces the retrograde ejaculation, and the younger men don't want to undergo any surgery because of its side effects, because of bleeding, and there's so many things. So since last 2-3 decades, we had this set of 5 to 10% of the people who come into the OPD with these problems are neglected a lot because there is no suitable treatment. Today, nearly about 32% of the men less than 45 years, more than 18 years, have some kind of obstructive urinary symptoms in my urology OPD as a quaternary center. So these people, we don't prescribe any medicine now. This simple device of iTIND, which is which mentioned here, which goes through the prostatic area and then which opens up and produces some kind of remodeling of the prostate. It is called as iTIND, Nitinol Device. This is an expandable Nitinol device which can expand the prostate without removing it, without causing any damage, so that the one person will have an improved urinary flow, satisfactory urinary flow, without affecting their fertility, sexual function, and ejaculatory function. So this is actually, if I say that, it's really a boon for the youngster who are having prostate problem as a decade invention, as a previous, a last decade invention. This is very useful for the younger people so that they should come. The only issue is that these younger men should not neglect their urinary problems. If untreated, if they come late after 40-50 years, they would have lost the time, they would have gone into bladder failure, they would have gone into urinary tract infection. Last, they might have gone into kidney failure.
This is Dr. Manohar's explanation. Apollo Hospital has invented a new technology, and they are successfully treated this prostate problem in youngsters. Thank you, doctor. Thank you. Thank you for your explanation.